Right, Meghan Markle just revealed a rare and scary medical condition that she suffered after childbirth called postpartum preeclampsia. What is it? How do you treat it? Is it fatal?
Yeah, Dr. Wendy McDonald joins us now to tell us more about that and some other issues considered before, during, and after pregnancy, because I didn't know you could get it after pregnancy.
You can get it after pregnancy, and you can get it at any time during the pregnancy.
Yes.
It's not uncommon. Yes, but it's not uncommon for somebody to be like 38 weeks and suddenly has preeclampsia. And a lot of my patients, if I tell them, hey, you have preeclampsia, they're like, well, but I've been fine this whole time. But that's how it gets you. Meghan Markle said it was rare. But actually, the stats show it can be anywhere from 3% to 25%
really?
of pregnancies to develop postpartum preeclampsia. And it can happen even up to 6 weeks after delivery. So it is hypertension, high blood pressure, okay? Often you're also spilling protein into your urine, which our urine does not typically have protein in it. That's one of the ways that we diagnose it.
Okay.
The biggest way that we diagnose it is by high blood pressure. But symptoms people can have: headache that won't go away, pain under their liver, which is like the right upper quadrant. They can have visual changes. Worth checking a blood pressure. And I always tell my pregnant people, have a blood pressure cuff at home. Have an automatic monitor at home, because it's one of the first things that we ask if a person calls and says, hey, I have this headache, it won't go away, Tylenol is not taking it away, what's your blood pressure? Or come in, let's check your blood pressure.
Because it's one of those things, too, that all the symptoms you describe, you can write off as something else.
You can, unless they don't go away. Like, that's the rule of thumb. Like, yes, pregnancy can bring about a whole lot of symptoms. Yeah. Actually, preeclampsia used to be diagnosed also with swelling in the legs, and we took that away because everybody swells. Everybody swells, so then everybody's worried. But, like, that is also one of the things that can happen with people with preeclampsia. But it's really a syndrome that can lead to seizures and even death. So it can be really, really dangerous. Yeah. And it's good for people to just be aware that it's out there.
Okay,
or say it's hard to reach your provider, because I know that's one of the issues I think with like maternal health and Black maternal health. It's like, are we communicating with our providers? Are our providers hearing us? Are they listening? Having the more information, the better. Okay, so if you have these symptoms and you're concerned and you check your blood pressure and it's also 145/95, that's a problem. Right. That's time to either go into the office, go into the hospital, be evaluated.
This is coming up on Black Maternal Health Week.
It is.
So what are the major messages that are going out during this week to people?
The message often that you hear over and over again is that Black women are 2 to 3 times more likely to die from childbirth or childbirth-related complications than women that are not Black. But what I really want to focus on is those symptoms, those signs, and also one of the things we don't talk about that much when it comes to the risk of mortality and morbidity after delivery is actually postpartum depression.
Yes.
Meghan Markle had that too. Suicide and harm is actually a really high risk. It's one of the highest risk factors for maternal death or postpartum death. And so it's one of those things to just be aware of, and also to tap in with our healthcare providers, our mental health providers, making sure that we are having our therapy appointments.